Susan Nelson with the Louisiana Partnership for Children and Families.
Back unless y'all finished.
Okay. I have a card for you, Miss Nelson.
Yes, sir. Good morning.
Good morning. How are you?
I am fantastic, Mr. Chairman. How about yourself?
Fine.
My name is Susan East Nelson. I'm the Executive Director of the Louisiana Partnership for Children and Families. We are a nonprofit organization that promotes evidence-based policy for children and their families in this state. Let me just say from the start that we do not take money from the state, so I'm not here to ask for money from
You're
our
not here
organization.
for money.
Well, I'm not here for money from my organization.
Okay. So say you might be the only person that's come through here the last couple of months.
I am here. I want to reiterate the point that Secretary Walters made about the $2.2 million that they need and the positions that they need in the Department of Children and Family Services. And I know that's an exceptional request, but it puts them back to where they were 10 years ago. And at this time, with the COVID-19 crisis, the need for child and family services, particularly among child welfare services, is about to avalanche. We've got a lot of children who haven't been in school, haven't been in front of their doctors. So yes, the reports of child abuse are down because the people who normally observe child abuse aren't seeing the children like they normally would. But as soon as we open back up and they start seeing this, we are going to have an avalanche of cases. And DCFS is going to need their positions to mitigate that crisis. So they need those 50 TOs and that $2.2 million in state general funds. They also need their budget authority for the federal funds that they have requested. And we're here to support them in that run. So, before I go any further, I want to tell you that our organization has committed our private resources to supporting DCFS. So recently, with the pandemic EBT information that was going out, we paid for the translation of all their materials to help them get them into the communities that needed to be served. So we support DCFS, and we have skin in this game that we've raised privately to support their efforts because we believe that these efforts are so important. As you guys know, COVID-19 has put so many families in this state into crisis. Did you have a question, sir?
Senator Henry does.
Oh, yes, sir.
Are you? I didn't open the. Haven't found you yet in this. As it sits right now, are you all have the positions?
No. They do not have the positions in HB1. They have not been added.
They didn't. And what about the funding?
That has not been added from the state general fund.
So you're not in the bill. That's what we're trying to find.
Yeah, that's
Chip Coulter from
I know who he
DCFS.
is.
So
Okay.
So you're not asking us to maintain what you have. You're asking us because we're just trying to figure out when people come and ask, we're trying to figure out whether
Exactly.
you want us just to leave you alone or you need more.
yeah, they need additional funds.
That's a distinct. There's a
Understand.
significant distinction
That's
there.
true. It is
To leave you alone or need more. So you all need the 50, need the two and some change.
Right.
And I definitely know you need the budget authority. I got that conversation last time.
Right, yeah. And so that's because we know that there's going to be an avalanche of cases. They are already
Oh yeah, no, I
worked.
agree with you on that. We
Yeah,
got you.
they are already worked to their absolute max. And if we add on what's going to be happening in the next year, probably from this crisis, just in the next year, they absolutely need the staff to help mitigate that and then into perpetuity.
And then the private the funds that you raise,
Mm-hmm.
how do you work that into to the services?
So when they produce a flyer or something, usually I'll get a call or somebody will send it to me and they'll say, hey, can you help us out and get this translated? And so I immediately hire my private contractors to translate it, and then I send it back to the agency for them to disseminate.
Okay.
We actually did the whole translation for the pandemic EBT website because it wasn't in a foreign language. And we did all of these promotional materials that, because as you know, there's only 2 days left. Monday, I believe, is the deadline for pandemic EBT. So we've really been trying to make sure that all of the families that are eligible have that information so that they can get that vital food resource for their children.
Gotcha. Okay, thanks. We're good. I mean,
Okay. I don't see any more questions right now. Just if if you want to
Can I
continue.
finish? Yeah,
That's
okay,
what I said,
great.
please.
Thank you.
Please, I'm not going to cut you off.
I appreciate it. So, the stress of this crisis, and I was really touched by a story that Representative Carrier told me last week in House Appropriations that just the week before, a family in his district, the father, kind of feeling the impact of the crisis, killed himself, and he was found by his children. And I think that's happening in a lot of places in this state right now. And one of the other things I'd like to suggest to you guys is that we look at the CARES Act funding, because it can only be used, of course, to mitigate the effects of COVID-19. But we look at that as a possibility for building a mental health infrastructure in this state. We've got a lot of families who just don't know what to do right now, and really, particularly in rural areas where if you ran the small business or you worked at the restaurant, there's not another place for you to go, in your town. You either need to pick up and move or start driving 100 miles away to find a job, if there is even a job 100 miles away. So, we don't have an infrastructure in this state that helps people deal with this stress. In parts of the state, there are no social workers. If you get up into North Louisiana, there is no services for mental health in a lot of areas. We don't have an infrastructure where we can even provide consultation for family doctors who maybe have a person who comes into their office and says, "Doc, I'm thinking about killing myself." They don't even have the resources right now where they can pick up the phone and call a psychoanalytic type person or a social worker who can help give those family resources. So I'd like to encourage you guys to look at some of the CARES Act money to see if we can take that money to say, look, we have got a terrible mental health crisis coming in this state because of COVID-19. Let's invest in building an infrastructure to help these families. And look, we know that children's mental health actually starts before they're born. We have the data that shows us that if the mom is already facing stress in her pregnancy and things like that, before the child is born, that the child comes out with that stress in their environment. And that makes them less ready to learn. So my colleague, Libby Saunier, is going to talk about investment in early childhood. If we invest in early mental health, then they're ready for the early childhood when they show up, because those brain pathways are being reinforced by positive experiences in their early life. So we absolutely need the $2.2 million for DCFS, because we're going to have a child welfare crisis that's coming imminently, and those positions to handle it. But I'd like to think that this group hopefully can creatively look at that CARES Act funding and say, what can we do to help these families who are really facing a traumatic situation because of COVID-19. And I just thank you guys for your support of our families today. We support the families of Louisiana, and this is why I do my job. I'm here because this is my state, this is the state that grew me, and I want to help every family have the chance to thrive like I did. Thank you.
Okay, thank you very much.
Mr.
Got a
Chairman?
couple of questions. Go ahead.
Mr.
Identify
Chairman?
yourself.
Yes, sir. Chip Coulter, Director of Governmental Affairs for DCFS. I would like to make one brief clarification. Ms. Nelson, and we appreciate that, made the point about how necessary, and you've heard that from Secretary Walters, that these additional 50 positions are. But I wanted to make clear that these positions wouldn't put us back to where we once were. Under the previous administration, we lost a net of about 1,500 positions. And Secretary Walters has said that in order to get just the child welfare division of our department back to where it needs to be, we would need an additional 500 positions. And we're certainly not asking for that right now. We're asking for 50. Honestly, if y'all gave us, just said, here's the money, here are the TOs for the 500 positions, we would not have the capacity to hire them right now, because we don't have the infrastructure, the human resources, the financial people to do that. But 50 positions, yes, sir, we would appreciate that. That would definitely be a step in the right direction. It's definitely needed. And I just wanted to make sure that this committee was not under the impression that, okay, DCFS would get 50 positions and, therefore y'all are good. it would be a very good step in the right direction, but it would certainly not be what the department is needed, sir.
Okay. Senator Barrow?
Thank you. And you just answered the question that I was just about to ask in terms of the number of people that you actually lost. I thought it was certainly more than 50. So I'm glad you clarified that. But I'm believing that we are going to be able to find that $2.2 million to help with this organization, because I do agree with you. I'm extremely concerned. And just yesterday, there was a story out of Monroe where a mother killed herself and her 4 children and I think a neighbor. And she was having some mental issues, and we don't know if there was any COVID-related issues, but she killed her 4 children, a neighbor, and herself. And so I am firmly confirmed. I firmly believe that we absolutely must build the infrastructure to deal with mental health. And I believe that we need to make sure that we do everything possible to ensure that the heart of state government is able to deliver as we continue to reopen. We're in phase 2, but as we continue to reopen, we're going to begin to see more and more, and we have to be ready. We can't get ready. We have to be ready. And so, I'm just hoping that and I believe that we will, because we understand the importance of this organization and what it brings to the table. But you clarified the question that I was just about to ask.
Thank you, Senator Barrow. We sincerely appreciate
And thank you, Ms. Nelson, for all the work that you do, because pointing out that mental health actually begins before birth. We were in the class together, and we learned how the brain develops, and when you have that level of trauma, the brain doesn't develop properly. And therefore, it impedes the learning ability. And then it just starts this whole barometer of things that go downhill if there's no level of positive intervention to help and assist. So,
Yes.
thank you.
Thank you.
Okay, thank you. Senator Cloud?
Hey there, my friends. Your $2.2 million ask for 50, which includes 50 additional positions, is all of this 2.2 go into salaries and benefits?
Yes, ma'am, Senator Cloud.
Okay, so I had just did a little bit of iPhone math, and that comes up to a total with benefits. If you divide that by 50 positions, it's about $44,000 a position. Just out of curiosity, the positions that you would be hiring, the people that you would be hiring, what level of, would they have degrees, and what would their background be?
Yes, actually, child welfare caseworkers are degreed individuals, many of them with or master's degree level. They may not be licensed social workers, but they may be a master's degree level social workers. And right now, the child welfare workers, it's actually a big issue, because a lot of these folks can make more money in other fields, in other places. I think we talked about, working at Costco. You
Literally.
could make more money than you make as a child welfare worker. It's a very difficult job. A lot of times you come into a family who just is not ready to embrace you with open arms, because you're there to, intervene in their private lives. And it's a very difficult job. So, that average of 44, that means in salary take home, they're probably only making 34 at that. If you think about the total benefits package. So it's really not a lot of money per person.
Senator Cloud, the level of salaries that we have throughout the department is an issue that we have been trying to address. And just as one example, maybe about a year ago, we were trying to fill a position in our finance area. Now, this position required a college degree in accounting. It didn't have to be a CPA, but it had to be a college accounting degree. We could not find somebody to even apply for it, much less fill it, because the position paid less than what the person going along the street collecting the change from the parking meters paid more. That job paid more than the accounting degree position at DCFS.
And I understand completely. I'm gonna be really honest with you. We hear this we hear this from every agency, and I think that's why Senator Barrow, I started asking the question, and Senator Barrow asks it too, because there is a disconnect. Some of the top people in these agencies are making a whole lot of money, and then all we're talking about are the people that are making the $20,000, $30,000, $40,000, and we have to get them up. But it's okay for all the top people to be getting these big dollars, and in raising them, we're raising the top people oftentimes too, and I have a problem with that. So I don't need an explanation.
I will say this about DCFS: Secretary Walters is the lowest paid
And I'm
agency
just-
secretary. And I know, I understand, but I mean, if you look at the other, she is way
We invite
lower.
this committee to
to take a
compare
look at her salary
our
compared
top
to the
salaries with any department in
Yes,
state government.
absolutely.
And you're just getting roped in. I'm sitting here listening to a lot of agencies, and I'm hearing these top salaries and these bottom salaries, and there is a disconnect
There
there,
is.
and there's a problem. I have a problem with it, a serious problem with it. That's not the way that
compare
business.
our secretary, compare our undersecretary's salary, et cetera, with
Sure.
with their counterparts, and
And I've
you will see that they are substantially underpaid. Realize that DCFS is one of the largest and most complex agencies in state government. Even after losing 1,500 people, we've still got 3,500 employees. Again, we would welcome that type of comparison by this committee or anybody else who cares to look, ma'am.
I believe you, Chip, and I know the kind of work that you all do. I've seen it in my own community. You guys have partnered with, missions that I'm on in my own community. So I'm just saying, I'm painting with the broad strokes here on everything I'm watching here, and you're just part of the conversation because you're sitting at the table. But so here's the other thing. I have to be responsible. I run businesses, and so I make responsible decisions with businesses. So $2.2 million you're asking for, and then we've talked a lot. I know you've talked about getting us back to where we used to be, okay, but in reference to it being more pressing now than ever because of COVID, to get some of these people on the ground. Two things. First thing is we have, it is my opinion that our churches need to be more involved in, in the mental health of the people in the communities. And the state does not need to, the state should help foster that. The state should help but our churches need to get out of the four walls that they're sitting behind and start helping the people in the communities. And I hope this is broadcasted because that is the mission that they should be on. And because that's what Christ would do and expect them to do. And then the other thing is, so when we do this, the 2.2, because of the pressing issue, because of COVID, this is going to be, you're not asking for one-time money. This is going to be every year. And in the same thing, every year there's going to be raises because that's just the way that it goes. And this is for all agencies. I mean, when is it going to, I'm just concerned. I want to help you because I know the kind of work that you do. You do really good work, but I'm concerned that we just keep growing this thing, and it
Right, but
scares me.
they are down 1,500 positions.
Right.
So we're really not growing it. We're just trying to stabilize it.
Senator Cloud, I would respectfully suggest that this is not a growing of state government, but a restoration, ma'am. Again, we lost 1,500 people. That was not because there is less poverty in this state. It was not because there is less child abuse and child neglect in this state. If anything, those have gone up. Mm-hmm. As a result, the caseloads that we have throughout our agency is tremendous. And people come, they join us, and then they realize after 6 months, I this isn't for me.
Right.
It's just too much, and they leave, and the caseload issue has been mushrooming, and we're trying, ma'am. I promise you, we're trying.
No.
But
If we're gonna
it
do
is our
this-
obligation to convey to you what is going on within our agency.
Mm-hmm.
And as a result of losing all those positions in the previous administration, we need help, ma'am.
Yeah.
We do.
We're going to do it here. We're going to have to figure out how to balance it somewhere else.
Senator, I would just
Thank
offer this stat that just came out last week. The U.S. spends twice as much on law and order as it does on these family services as the United States as a whole. And since the 1980s, we've funneled money away from poverty-serving programs or family support services programs in order to beef up our response to crime, which is the outcome of poverty. So it's like we're throwing good money after bad when we continue to do that. And I think we've seen a lot of the things that have happened in the last few weeks, the protests and people who are responding to that hurt, that, you know, we spend this much on crime, but we don't spend this much money trying to shore up families and helping them support. I think DCFS would like nothing more in this world than to keep families stable and together and loving and create these environments. But we don't have those services, so they come in at the last minute to take the kid because the worst has happened. I got a call earlier last year. A friend of mine said, "Hey, can you help me? I've got a child at the hospital who's been sexually abused, and they don't have a caseworker who could show up right now." So we had a child who had been sexually abused sitting in the hospital, and the caseworkers were so overwhelmed that they couldn't get there to do the forensic exams and things like that at that level.
Okay, so because you guys have such a huge turnover, it's very I've heard this. It's very emotional work. It's hard for people to do. So your vacancies, do you have quite a bit of vacancies right now?
We always do, ma'am, but
Because of the
the
turnover.
vacancy issue is one that, I mean, we are constantly hiring. We have to, I mean, for example, when we have a vacancy, we typically we'll hire 2 people for that one spot, because of course it takes a while to train them and get them actually hired through the process. And then because we know that either one is going to quit or there's going to be another vacancy pop up somewhere else, that we'll be able to just if we keep both of them, we'll be able to put them in another position.
Yeah.
We're replacing those positions as quickly as we can, ma'am. Can I make one more point about your churches, ma'am? Please know that your comments are well received, and we have been working with the church community throughout this state. The First Lady has got an initiative to work with the churches to provide more foster families throughout this state. It's been said that if every church would just find one family within their congregation to be a foster parent, then boom, that would take care, that we would have homes for every child who is needed. Right now we don't, ma'am. I mean, you can look on our website and see a listing of children who are available for adoption, who desperately would love to have a home. We're trying to find homes for them. And we have a wonderful foster family community. We're very appreciative of them. But we need more. We need more of the foster families. We need more employees as well, ma'am.
Yeah.
And I'll highlight what
Senator Johns?
Oh,
Thank you, Mr. Chairman, and I've been here a long time, Mr. Coulter and Ms. Nelson, and I've watched what's happened to DCFS. I've watched it be decimated over the years by these 1,500 positions. And we're talking about children who are in a position it's not their fault that they're abused. It's not their fault that they're in foster care. It's not their fault that they're being human trafficked. And Senator, I agree with you about faith-based organizations being involved. I'm very involved. I sit on the board of directors of a private foundation called Metanoia that deals with human traffic, minor female victims of human trafficking. If it wouldn't be for DCFS, that facility and that home today would not be a reality. So thank y'all for cooperating and working with us and helping us have a real impact. And we are having a tremendous impact because of the work. I mean, we had to jump through hoops because of federal laws, because of state laws. We had to make we filed a lot of legislation just to make it a reality. But y'all could have said, "Nah, we don't want to deal with that. We got other things to do."
Do have other things to do, sir, but
I know,
again,
but y'all made it,
that
y'all
was a
made it a
wonderful effort.
reality to happen, and it's the only such facility in the state. But it is faith-based, and it's working very well. And I think that's a perfect example how our faith-based organizations and our state government can work together.
And can I also add, sir, I mean, Father Bahi and those wonderful nuns there at Metanoia, they have done just a tremendous job there. That is an example of a program of a private-public partnership that is absolutely working, and we sincerely appreciate all the effort that has gone into that, sir.
Well, and Senator, in your district, the Louisiana Children's Methodist Home in Sulphur is doing the exact same thing.
is.
They have a faith-based approach, and they deal with some of the most traumatically injured children. They have this amazing center up outside of Ruston called the Owl Center,
Right.
where they take some of these kids who have just had traumatic things happen, and they have equine therapy. They have a big lake. The kids they make probably the best blueberry jelly I've ever eaten in my life. And salsa, and they have those kids and doing, getting them recultured and using a religious model. And then DCFS this year, well, actually last year, 2019, I feel like 2020 has been going on for like 20 years now, had a model called My Community Cares, and they've been going into Baton Rouge. They've got one in the Alexandria region. They've got one in Livingston Parish where they have tapped into, we've actually had our meetings at churches. And we're talking about what we could do in the communities to help prevent these child welfare issues from coming about. So DCFS does so much more work than just correcting these problems. But unfortunately, right now, there's a lot of child welfare problems.
And I fully agree with you. And I'm in hopes, I'm only one member of this committee, but I'm in hopes that we can help you in some way, shape, or form. And
Thank you, sir.
I don't think we're growing your agency. I think we're putting a very, very small piece of the huge puzzle back into place for you, because if we can't help our children of this state, then what are we doing here?
Exactly.
So.
Thank you, sir. Thank you for your leadership.
Chip, if the 2.2 million, will that help you draw down any kind of federal funding or?
Well, yes, sir, and I've sent that to you. It's the 2.2 in state general funds, and then
Right.
we need
It's
the
$4 million.
authority for
For $4 million in federal funds, so there's a match.
little bit less, yeah, but
it might be like right at 4.
Okay.
Yeah, he's got the email. So yes, there is a federal match component that allows them to draw down additional funds.
Okay. All right.
it.
Thank
Yes,
y'all
sir.
for your work. Keep those foster care adoptions rolling. So my 31-year-old daughter's adopted, so you know where I stand on
Yes,
adoptions.
sir. Yes, sir. And there are other members on this committee who as well who are have supportive of the adoptive community and have adopted children as well. And we recognize that. We sincerely appreciate that, and we appreciate your consideration. Thank you.
When you put a child in a permanent home versus foster care, we've accomplished a lot. So,
Yes, sir.
Yes, sir.
right. Thank y'all.
Thank you, sir.
Okay. Thank you, Ms. Nelson,
Thank you,
Chip.
sir.
Thank you, sir.
Appreciate you.